participant has joined the meeting.
One nation, under God, indivisible, with liberty and justice for all. Please be seated. I have a required notice. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to the item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. 5 minutes. Vendors, suppliers, and other persons seeking hospital contracts awarded on a competitive bid basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of a representative of this board, the medical staff, administration, legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. Okay, first of all, we seek approval of the orders of the day. So moved.
Second.
All those in favor respond by saying aye.
Aye.
Questions? Thank you. Second, I seek approval of the minutes of the meeting of June 21st. A motion, please. All those in favor respond by saying aye. Aye. Questions, comments? Motion carries. Thank you. There are no board reports, medical staff reports. First, Dr. Fiorica.
Gerald Henry
has joined the meeting.
Doctor, please.
Yes, on behalf of this
Okay, he's in.
behalf of
Thank you.
SMH-Venice and Sarasota this morning. I do have a report on SMH-Venice on behalf of Dr. Jefferson and the leaders at Sarasota Memorial Venice medical staff. I would like to ask for a motion approving Sarasota Memorial Hospital Venice physician privileging forms in pediatric cardiology and pediatric gastroenterology as recommended by the SMH-Venice Medical Executive Committee.
May I have a second, please?
So moved.
All those in favor respond by saying aye. Aye. Opposed? Motion carries, Doctor.
Being very quiet, want to help, went out and bought us a donut card.
Is that what you have, Doctor?
Yes, that's all.
And Dr. Watson, do you have?
I have nothing to report.
Thank you very much. Okay, Secretary's report. Sarah, are you out there?
A used interstructure with some fabrication and then the
Do we have Sarah?
Hi, I'm here, yes. Our next board meeting will be Monday, August 16th, 2021. From 9 to 10:30 will do mission and planning. From 10:30 to noon, we'll do the finance committee. From noon to 12:30, closed session hospital board meeting. From 12:30 to 2, financial review, board issues, and board lunch. From 2 to 4, the board meeting. And then on Thursday, September 9th, we will do the 5:01 p.m. We will have the preliminary budget and millage hearing.
Thank you, Sarah. Travel safe. Next.
Sarah, that was August the 14th.
I'm sorry?
That was August the 14th.
Yes. August the 16th.
Thank you.
Sorry, Monday, August the 16th.
Monday the 16th.
Yes.
Okay, I thought you said 14th. That's why I checked.
16th.
Okay, 16th.
Thank you.
Thank
Sorry.
you, Daryl. Treasurer's report. Jody Virgilio.
Yes, I just have one motion today for approval of the bad debt and charity care. I move approval of the bad debt and charity care for the month ending June 30th, 2021 in the amount of $22,874,000.
We have a second, please. All those in favor respond by saying aye. Opposed?
Aye.
Thanks, Joe. Financial highlights. Bill Bolgen, our Chief Financial Officer. Bill?
Thank you, Mr. Chairman. I have the financial highlights from June, and we'll start with total revenue. Total revenue for the system in the rating agency format for the month of June, $123,512,000 compared to a budget of $89,589,000 for fiscal year to date, which is 9 months of activity. Total revenue of $906,173,000 compared to a budget of $834,634,000. For expenses for the system, again in the rating agency format, for June, $91,887,000 compared to a budget of $84,925,000. And fiscal year to date, total expenses of $800,323,000 compared to a budget of $787,471,000. Operating income for the system for June, $31,625,000 compared to a budget of $4,664,000. Our operating margin for June was 25.6% compared to an operating margin of 5.2%. And I'll point out that the large variance there was largely driven by recognition of the provider relief fund money that we got last year, recognized as revenue. For fiscal year to date, again, this is 9 months of activity. Operating income $105,850,000 for operating margin over 9 months of 11.7%, compared to a budget of $47,163,000. We budgeted for an operating margin through 9 months of 5.7%. Moving to statistics for the hospital, average daily occupancy, and these are all fiscal year to date statistics. Average daily occupancy of 649 patients compared to a budget of 602. The average acute length of stay so far this fiscal year has been 4.65 days, and last year was 4.43 days. Admissions through 9 months, 333,463 compared to a budget of 33,334. And for surgery cases, 18,302 compared to a budget of 18,003. And so far through 9 months, we've had 2,854 births compared to a budget of 2,955. Outpatient registrations through 9 months, 370,780 compared to a budget of 369,686. And registrations in our 2 emergency care centers total 86,076 compared to a budget of 94,264. So far through 9 months, our case mix index for all patients is 1.88, and for Medicare patients, 2.02. Mr. Chairman, that concludes my report.
Thank you, Bill. Up next, committee reports, joint finance and athletic committees, minor finance committee chairman. Britt, please.
Thank you. The minutes of the May 17th, 2021 meeting of the Finance Committee were approved. Todd Webster and Julia Sabina from KPMG presented their audit plan and strategy for the external audit of the fiscal year 2021 financial statements of the Sarasota County Public Hospital District. They reviewed their risk assessment, plan deliverables and timelines, and their independence. Next, we had Bill Wolgen, our CFO, present information for the committee to consider for setting the preliminary tax millage rate for fiscal year 2022. He outlined the system's growth plans for fiscal year 2022 and beyond, and he also reviewed the cost pressures that are impacting the system in preparing the budget for fiscal year 2022. The taxable value of property in Sarasota County, including the value of new construction, has increased 7.6% over the past year. Management's recommendation is to set the fiscal year 2022 preliminary millage rate at 1.0420, which is the same as the current millage rate. The committee discussed the information provided as well as the timeline for the process of holding public hearings on and setting the millage for, and based on that information and discussion, I hereby move that the board set the fiscal year 2022 preliminary millage rate at 1.0420, which is the same as the current millage rate, and to set the first public hearing to adopt the proposed budget and millage rate for September 9th, 2021 at 5:01 p.m., and the second public hearing to adopt the budget and the millage rate for September 2021 at 5:01 p.m. Both hearings currently scheduled to be held in the old boardroom and auditorium on the first floor of the Sarasota Memorial Hospital, where we are now, all as recommended by the Finance Committee. Is there a second?
Second.
All those in favor respond by saying aye.
Aye.
Opposed? Motion carries. Continue, please.
Thank you. Bill further presented a request to purchase for $35,750,000 plus closing costs the leasehold interest held by Citadel Properties on the Sarasota Memorial Healthcare Systems Healthcare Center at Clark Road. Bill reviewed the history of the facility development, the existing lease structure, the services housed within the building, the benefits of making this purchase, and a comparison of appraisal valuations to the proposed purchase price. Based on the information provided, I move approval of the purchase of the leasehold interest as described for a total transaction cost of the purchase price of $35,750,000 plus closing costs, and to authorize administration to take such actions and execute such documents as are necessary to complete the purchase, consistent with the lease termination agreement executed between the parties, and further move that the fiscal year 2021 capital budget be increased in an amount equal to the total transaction cost as recommended by the Finance Committee.
A second, please. All those in favor respond by saying aye.
Aye.
Hearing none, the motion carries. Continue, please, Brett.
Jennifer Storch, Director of Ambulatory Services, presented a proposal to purchase a new CT scanner at a cost of $1.4 million to replace the scanner at Clark Road. The current CT scanner is 14 years old and is at the end of its useful life, resulting in frequent downtime. It is difficult to secure parts needed for repairs, and when they are located, they are extremely expensive. This is a high-volume CT scanner and the only one within the ambulatory network that can perform advanced cardiac imaging. As of Friday afternoon, the scanner was no longer operational. Based on the foregoing, I hereby move approval of the purchase of a replacement CT scanner for the Clark Road imaging location in an amount not to exceed $1.4 million, $1 million of which is included in the fiscal year 2021 capital budget, and $400,000 of which will be included in the fiscal year 2022 budget, and that the board authorize administration to issue the purchase order for the CT in advance of final approval of the fiscal year 2022 capital budget to expedite the delivery of purchased equipment and minimize the length of time the advanced equipment is unavailable as recommended by the Finance Committee.
May I have a second, please? All those in favor respond by saying aye. Aye. Opposed?
Aye.
Motion carries. Please continue, Brett.
Robert Santos, Director of Biomedical Services, presented a proposal to purchase two new DaVinci Xi surgical robots at a cost of $3.6 million to replace two previous version DaVinci robots. Robert discussed the benefits of the latest technology robots and presented information on the number of surgeons performing robotic procedures and the volume of these procedures since 2006. Purchase of the two DaVinci Xi model robots will improve patient outcomes and increase physician satisfaction. Based on the foregoing, I hereby move approval of the purchase of two DaVinci Xi model robots for a total cost not to exceed $3,600,000, which will be included in the fiscal year 2022 budget. Purchase orders for which will not be issued until approval of the fiscal year 2022 budget as recommended by the Finance Committee.
May I have a second, please? All those in favor respond by saying aye. Aye. Opposed?
Aye.
Motion carries. Thank you very much, Fred. Next up,
Nay.
Quality Committee, Dr. Richard Raymeyer. Doctor?
Quality Committee has no public report because of confidentiality. However, I would advise the board that the quality in this hospital is superb.
Thank you. Next up, our president, David Barringer. David?
Thank you, Mr. Chair. I'm going to start today with our organizational report card, as we do each and every month, and look at our 5 areas of focus. The first being in the area of service. We have our goal of having our likelihood of recommending the number of services being 8 out of 10 at greater than the 75th percentile. I'm happy to report that we are exceeding that goal, and we are hitting 9 out of 10, and I'll show you the details here in a minute. The second area of focus is on people. We have a goal of having our new hire retention percentage of regular and full-time and part-time employees hired in 2021 that are still employed as of September 30th, 2021. We had a goal being 83% or higher. I'm happy to report to the board we're also exceeding that, and we're hitting 89.71%. In the quality focus, we have our goal of having our infection prevention, which is our combined overall standardized infection rate, being less than 0.88. Happy to report to the board we continue to exceed that at 0.7. Just to remind the board that a national standard or expected number is 1.0, so we already set our goal considerably less than what the national average or the expected is. In the finance area, you already heard from our CFO, Bill Wojcik. Our organizational finance, our goal is to have our operating margin at our budget, which is 5.5% or higher. We are tracking higher than that at this point, and we're at 10.1%. And then finally, in the area of growth, we have 2 goals. The first being our inpatient admissions and outpatient observations being at 51,000, 164,000 or higher. We are just over that, or projecting to be over that at 51,809. And our other goal is outpatient registrations. We have a goal being 977,000. We are tracking a bit lower than that at 968,000. So when we dive a little bit deeper into our patient experience report card, just to remind everyone, this is for likelihood of recommending, and we look at 10 areas in the organization. The first, or the middle column, which is the first numbered column, is our actual scores. The next one over is the national median score, and then finally the far right column is the 75th percentile, which is what we gauge ourselves off of. As you can see, all 10 areas are greater than the 50th, the national median score, and all but one are greater than the 75th score, the one being the main ER on the main campus. Their score is still at 83 and very healthy there, but also we're always working to improve. Our next slide, we look at SMH and Blue Cross did come to an agreement. Sarasota Memorial Healthcare System recently reached a 3-year renewal agreement with Blue Cross Blue Shield of Florida. The previous contract with the insurer was set to expire at midnight on June 30th, but the renewal allows patients enrolled in Blue Cross Blue Shield health plans to continue to have uninterrupted in-network access to the hospital, first physicians, providers, and the outpatient and urgent care services through June 30th, 2024. The agreement will also cover services provided at the new Sarasota Memorial Hospital in Venice when it opens this coming fall. A full list of health insurances accepted by our system is posted on our website. I invite you to take a look. Elsa was a good test run for a storm season. So SMH staff worked hard through the July 4th weekend to monitor and prepare for Hurricane Elsa. Our emergency management team kept in close contact with local officials to discuss the storm's track and determine if the hospital would need to shelter any medically dependent people. Elsa was not a severe storm when it moved to our region, and shelters did not open, but it was a good test for emergency preparedness and a reminder for staff to review their personal plans and keep homes and families safe. Our trauma center marks its 5th anniversary of full designation. 5 years ago, Sarasota Memorial successfully completed the state's application process to become a Level 2 trauma center. In 2015, SMH received provisional approval from the state to open a new program, but to earn the full 7-year designation in July 2016, the team had to demonstrate compliance with rigorous trauma standards and undergo a site visit. The SMH Trauma Center is the only trauma program in Sarasota County and helps ensure that severely injured residents from our area can be transported to SMH rather than to a center in another community. From May 2015 through April 2021, the center has seen a total of 21,977 injured patients. So thank you all to everyone who made that happen. I've got to tell you, particularly Dr. Fiorica, who was chief of staff when we underwent this and was my partner in making all this happen. It would not have happened if it wasn't for that man down at the end of the day. So thank you, Dr. Fiorica. Exactly, he deserves it. And there's 22,000 people that have been treated here, right? All right, anyway, I'll go back to the script. Our CNO was recognized by Women's Hall of Fame. Congratulations to our Chief Nursing Officer, Connie Anderson, who was sitting right behind me, who was recently included in National Women's Hall of Fame book for Lives and Legacies. The Hall of Fame is dedicated to honoring and celebrating achievements and distinguished women, American women, and the entry for Connie includes an overview of her career as a nurse leader. Congratulations, Connie. Is she read? Yes. Our Gallup survey measures employee feedback. The 2021 Sarasota Memorial Employee Opinion Survey kicked off July 12th and will run through July 12th. This is time SMH has used the Gallup organization to conduct our employee survey, which helps us identify what's great in our workplace and what opportunities for our improvement. The employee survey typically takes place every 3 years at SMH. However, we were due for a survey in 2020, but postponed it due to the pandemic. So I will tell the board we monitor it every day, what our participation rate is, and I believe we're approaching the 70% participation already. So that we think that's a very good start. So SMH staff honored in the July 4th, number of July 4th parades. Sarasota Memorial staff were invited to march in special July 4th parade, paying tribute to healthcare workers. First responders veterans parade took place in downtown Sarasota along the bayfront. You'll see several pictures down there, including both our board chair, Mr. Jim Meister, and our board vice chair, Sharon Westwood Peters. So we appreciate both participating. It looks like y'all had a lot of fun. SMH-Venice Chief Nursing Officer Gene Lucas also served as the Grand Marshal in Longboat Keys' annual Freedom Fest and Parade, representing our caregiving heroes. And Gene, I know you're behind me too. And Gene, if I was really wanting to take the videos that I got, but I wanted to live. Thanks for doing that, Gene. Construction progress. SMH-Venice, y'all heard a report from Sharon earlier today talking about the incredible progress they're making on that facility. We have installation of major equipment underway. The SMH public safety, supply chain, IT, facility staff on site to support the activation. More than 70% full-time staff have now been hired, and we're on track for completion in the fall 2021. Next up is the construction progress on our Oncology Tower. I'm not going to go through this whole list that you see in front of you, but it's extensive, all the things that we have gotten taken care of. Well on our way to be complete in fall 2021 as well. Lori Lang is overseeing this along with Kelly Batista, and it's pretty remarkable the progress we're making on a day-to-day basis. And that is my report. My final request to those members and public that are watching this is to get out, and if you haven't already, get your shot. So that's my report, Mr. Chair.
Thank you. Karen, does anyone has signed up to make any comment?
No, sir.
Thank you, Karen. Legal matters, Carolyn Gaelic.
I have no report.
Thank you. Having completed our agenda, we stand adjourned. Thank you very much.